The Pathways to Community Living initiative is a coordinated statewide approach to supporting people with severe and enduring mental illness who've been in hospital for over 12 months to, wherever possible, re-establish their lives in the community. The initiative has been established as part of the New South Wales Government's mental health reform program, specifically the commitment to strengthen mental health care by further developing effective community-based residential care and support for people with mental illness. It is an important part of the Ministry's program that people are being given the opportunity to design and create their own pathway to a better life in the community. The Ministry of Health, together with local health district clinicians, are supporting people who are inpatients, their families and friends to make this happen.
While there has been a decrease in the inpatient numbers over the last 20 years, data gathered by New South Wales Health indicates that there are around 380 people who are resident in acute and non-acute mental health inpatient units for over a year. Some people have lived as inpatients for many years. All long-stay patients have a serious mental illness, and many have complex clinical, physical and behavioural support needs that have prevented them from finding suitable accommodation and support services in the community.
You suffer a physical illness, you only stay in hospital until you die if you are suffering from a palliative or terminal disease. Many mental health patients have stayed in hospital indefinitely, and the hospital setting is not a natural setting for them to be in. That is why we would like them to be resettled into the community wherever possible. It is not a matter of not receiving the best care in hospital. It's a matter of people needing a place to be called home.
New South Wales Health has looked into the best available national and international evidence on approaches to supporting people with complex mental illness to move out of hospital and live in the least restrictive settings in the community. The evidence has told us this: living in the community improves quality of life. We need new solutions tailored to people's needs. Comprehensive assessments and pre-transition work followed by managed transitions. Communication with stakeholders is vital. Inpatient solutions as well as community solutions, a statewide, coordinated and collaborative process. Using evidence, aggregated data and advice from clinical and other experts, New South Wales Health has developed 3 models of care. Community-based services for people with issues of ageing. Community-based services for people without issues of ageing. Inpatient services for people with high issues of clinical need. The Pathways to Community Living initiative is a partnership approach. Community managed services, additional mental health clinicians, pathways to community living. The Pathways to Community Living initiative is a major transformation in the way that mental health care is delivered in New South Wales. The work involved is complex and multi-layered. The initiative is being rolled out in 2 stages.
And under stage 1, the New South Wales Ministry of Health is working to embed the initiative at the local level with LHDs and to create, in this amazing opportunity, community places for people who are long stay with issues of ageing. New positions have been established in LHDs. New governance structures have been put in place in the LHDs to drive the initiative. Tenders have established specialist mental health aged care partnership services in the community. Training for mental health staff is being rolled out. Screening and assessments of all long-stay patients are being conducted to better identify a person's needs and preferences for life in the community. Under stage 2, further work will be done on refining the models of care with you as LHDs and with our partners and consumers on models of care for people who are long stay without issues of ageing, people who have very complex needs, are younger and have issues of risk.
I think some of the key elements around working with other social workers and other health professionals in working through this transition into the community for long stay patients would be all having the same message. I think that that's really important. So all of us at different stages communicate with the families, whether they're coming in to visit or they ring the ward for some reason, and I think that we all have to be on board and giving the same consistent message to the carers so that they know what's actually happening. I think it's really important to go slow. A lot of these clients or consumers have been in this hospital for many, many years, and the carers can still remember the trauma that they've gone through over the years for getting care for this person that's here in the hospital. So they really feel safe that the person's here, they're getting the care that they want the person to receive, and at times can't understand why would we want to transition someone from here into the community.
We need to transform the system of mental health care so that long-stay admissions are decreased and contemporary, recovery-oriented services are always available to people with serious and enduring mental illness. This requires us to work collaboratively and imaginatively with consumers, their families, others working in local health districts, and those in the community. We still have much to do, but we're well on the way.
People just want a place to call home.
If you'd like more information about the Pathways to Community Living initiative, please visit the New South Wales Health website.